Lipiflow is one of the most advanced dry eye treatments that someone can get at an eye clinic. People have had amazing results to help them with their dry eye condition, but the tricky part is that it can be a costly procedure with no insurance coverage. So the question is Lipiflow worth it? Let's focus in. Hey, howdy everybody, this is Dr. Neal Guymon, Dr. EyeGuy, with a show that keeps your eyes healthy and your vision clear, and I make videos all about the eyes like this one to help you with those tough decisions you have to make about your eyes. So consider subscribing for my future videos when they come out. Now, let's focus on Lipiflow. Lipiflow is one of the most advanced FDA-approved dry eye treatments that you can have done at your eye doctor's office if they have it. It targets and treats the oil glands in your eyelids, specifically if you have Meibomian Gland Dysfunction. The oil glands in your eyelids are called Meibomian glands, and they run vertical up and down your eyelids, top and bottom. Now, they're responsible for pumping and pushing out oil over the top layer of your tears. If you don't have enough oil or the wrong type of oil, then your tears will evaporate, leaving your eyeball exposed to the air, causing them to get dry and inflame and causing dry eye symptoms that you might expect. Now, if your oil glands are clogged or they're shortened or they're atrophied or you don't have the right type of oil or they're plain not functioning very well, then you have what's called Meibomian Gland Dysfunction. And it's one of the most common core issues to dry eye problems, and that's exactly what Lipiflow treats. It treats the core issue. It treats Meibomian gland dysfunction. Now, the actual Lipiflow procedure is ran by a computer console and single-use activators. Now, before you actually do the procedure, your eye doctor might do a little bit of prep work. Usually they'll put in an anesthetic eye drop to numb your eyes first, and then they may also debride your eyelids or clean off any capped hardened oil from your oil glands, and that will make the procedure more effective. Then they'll place the actual activators between your eyeball and your eyelids, top and bottom. Now, what's kind of neat about the activators, especially the white bowl that you see here, is that it serves two functions. The inside will protect your cornea from the actual procedure. The outside is where all the heat is applied, and that's applied to the inner layer of the eyelids. And that's part of what makes this procedure so effective, is that it's applying the heat to the inside of the eyelids and not the outside. So once your activators are in place, the device is turned on and the activators are heated up to exactly 42.5 degrees Celsius, the heat that they found that works the best. Now, each activator has these little bladders on there that will massage your oil glands, and they massage in a peristaltic motion, pretty much meaning that they start from the beginning of the oil glands or the base of the oil glands, and then they'll squeeze and massage, trying to remove and push any obstruction or hardened oil out of the opening of the oil gland. It's kind of like you're pretty much just milking your own oil glands. Now, with this combination where you have the heat applied to the inside of the eyelids and that peristaltic massage, that combination works really well at cleaning and clearing out your oil glands to help them function better in the future. Now, the procedure lasts exactly 12 minutes. You do both eyes at the same time, and then when you're done, they're able to remove the activators really safely, and then you're all finished. Now, what to expect right after the procedure: you may experience some redness, itchiness, maybe some more dryness or inflammation. Sometimes your eye doctor may prescribe a steroid eye drop to help with the inflammation that you might have, but they're pretty minimal, doesn't last long, so usually really safe to do. Not a lot of people have any side effects after the procedure. Now, like I said in the beginning of the video, is that Lipiflow is not cheap by any means. The actual device costs thousands of dollars. The single-use activators can cost hundreds of dollars. So it's pretty expensive just for the doctor to have in the clinic. And then on top of that, Lipiflow right now is not covered by any insurance companies, so it's usually an out-of-pocket cost. Now, depending on where you go, you may be looking at about $1,000. That's for both eyes to have done, $1,000. Now, what's nice is prices have been coming down a little bit. The activators have been getting a little bit cheaper, and so you're slowly seeing doctors being able to lower that price. Now, the question of the video: even with the cost of Lipiflow, do I think that Lipiflow is worth it? Yes, I do, but let's go over a few things. Now, first things first is you want to make sure that your dry eye condition is caused by or partially caused by Meibomian Gland Dysfunction. Now, the eye doctor that has your Lipiflow should be able to take pictures of your oil glands, also check the function of your oil glands to see if you have any atrophy or low functioning glands. If so, you'd be a very good candidate for Lipiflow. So here's a quick example of what your oil glands might look like, with the top picture being more normal and then this middle picture being more moderate, where some of the oil glands have atrophied and some are gone. Some oil glands show some blockages in there. And then this bottom picture more severe, where the oil glands are pretty much gone and not functioning at all. Now, usually what we tell people is once those glands are gone, there's no getting them back. So the goal of Lipiflow is not only to improve the function of your oil glands, but try and preserve them to keep them from advancing to a more severe stage. That will help your dry eyes in the future. Now, that being said, there are some small studies that have shown some promise that after people have had Lipiflow on a microscopic scale, there's some regeneration. Some of the oil glands have come back a little bit, so we'll have to see how those studies play out once they dive into it deeper. Now, one thing to consider is Meibomian gland dysfunction is a chronic disease, usually involving inflammation, and so you already need to have a dry eye treatment regimen put in place. That can include lipid-based artificial tears, eyelid hygiene, omega-3s, fish oil supplements, something that you're already doing to help your dry eyes. That will make the procedure more effective when you have it done. Now, if you aren't doing any dry eye treatments, check out my video series on dry eyes to help you get started. Now, I'll put links in the description below for all my recommendations about omega-3s, artificial tears, also how you can check your own omega-3 levels at home. Now, does Lipiflow work? Yes. Is the cost of Lipiflow worth it? Yes. Is Lipiflow the end-all be-all work for everybody? Unfortunately, no. Now, like I said before, a study showed 85% of the people that had this show improvement in their symptoms. There was one other study that showed 51% of the people got to the 4-year mark with improved symptoms and not needing a repeat Lipiflow, as long as they were sticking with their eyelid hygiene and their usual dry eye treatments that they were doing. So very important, keep on doing your normal dry eye treatments. If Lipiflow is an option to you, I strongly recommend considering it, especially if you have Meibomian gland dysfunction. It can treat your oil glands as well as preserve your oil glands for the future, hopefully slowing down the progression of your dry eye condition. Hey, thanks for watching the video. I hope this helps you make a decision if you're considering Lipiflow. I'm Dr. Neal Guymon, Dr. EyeGuy, focusing on you and your eyes. Stay focused and make sure you check out my other videos, clicking or tapping the screen right there, and I'll see you in the next video.